Hey community, we're back and I'm Brandy B, the community MP.
And I'm Brandy G, the community MP.
And together we are
B&B, the community MPs.
Okay, B. So today let's talk to the community about heart failure.
Okay. So we're gonna talk about heart failure, which sometimes is used interchangeably as congestive heart failure. So some people may say congestive heart failure, some people may say heart failure. Okay.
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 So what
So
is
what?
it?
Okay, you want me to tell what is heart failure?
Tell them what it is.
All right. So heart failure is usually when the heart is just not pumping or working like it should. Basically,
Mm-hmm.
that's what it is. So what happens is with congestive heart failure, the heart doesn't pump enough oxygen to the other organs in the body, and it reduces the blood flow, which causes congestion to occur in the lungs. Okay,
Okay.
and also what can happen is the heart may not pump. You may not get the blood flow back from the body back to the lungs.
Okay.
So yeah. So basically your heart is not pumping like it should.
Okay.
So basically that's what congestive heart failure. So there's three different types. You have congestive heart failure, you have right-sided heart failure, you have left-sided heart failure. But today we're going to focus on congestive heart failure.
Okay. So some facts about heart failure. It's the leading cause of death in people over the age of 60. And listen to this. 6 million Americans are living with heart failure, and more than half of them will die within the next 5 years. I don't want to know. Like, if I get diagnosed with heart failure, then I'm automatically going to know that I got a 50% chance that I'm going to live greater than 5 years. And I don't want to know that.
So you don't want to know that, but some people, that'll scare them. So that'll scare them to make sure they do what they need to do to take care of themselves. They'll try to treat it, get treatment, try to see how they can prevent it from worsening.
Yeah, that's true. That's very true.
Yes.
And then, so guess how many cases are diagnosed every single year?
Let's see. I'm going to see close to 1 million.
You're right. 900,000.
That's a lot. That's a lot. And it's something that I think we can prevent by preventing other diseases like high blood pressure, coronary artery disease, controlling our cholesterol. This is a disease that we probably can prevent. So that's a lot. Yeah. 900,000 people. That is a lot. So.
It is preventable. And we will talk about ways to, help people prevent it. But some people, are predisposed. Like if they have coronary artery disease, high blood pressure, like you said, if you've had a heart attack in the past, that puts you at higher risk of developing heart failure. Yes. And then most people with any type of cardiac problem, so any type of heart problem, puts them at increased risk.
Yeah, so that's the downfall. But how do they diagnose it? So a lot of times it may be diagnosed based on symptoms first. Mm-hmm. It's like a patient may come in, lots of fluid on their legs, swelling, the legs are swollen, mm-hmm. They're short of breath. You see them, they can barely get to the exam table from the chair without, with the huffing and puffing. Yeah. So sometimes it can be diagnosed. So that alarms us to order like different lab tests. Sometimes we can get an EKG or ECG, chest x-rays, CT scans. So, I think the symptoms is what you may see first and what triggers you to order the other things.
Yeah. And if usually, like with me and you, we're primary care providers. So once we see those, those symptoms like the shortness of breath when they're coming in, their legs are looking like little sausages, and then just like some other vague symptoms that they may not notice, but we're used to seeing, then we typically send them to a cardiologist so that they can, maybe get an echo, stress test, and all that good stuff.
Yes. So yeah, usually you're right. We use these, consult a cardiology to see if they can assist us with treating the patient. Yep. Really? You're absolutely right.
I think that because I have such a big loving heart that the cardiac system is my favorite system.
It is?
Mm-hmm. It is.
I don't know. I think because I did ENT for so long, I love ear, nose, and throat. I guess because that's probably what I'm just so comfortable with. I did it for so long. But yeah, then after that, I would have to say diabetes.
Really? Yeah, but you're really good at ENT. I'm always like, hey, hang on, let me go get my soul sister to look at this ear real
That's
quick.
okay. And you're good at a lot of things too. It's like, B, check this out. But so what I know what you're good at, what I think you should be doing is cutting people open.
Oh
You
my
like
gosh.
cutting in. Yes.
I lanced a little abscess on a lady's scalp today.
See, that's what
I
I'm
was
saying. You
it
like
made,
that. So yeah, so
it made my day. My day was crazy, but that little bit of stuff flowing out ah, just just gives
I know.
me a
So
sense
whenever
of,
I get a patient that got something that needs to be lanced or something, I'm gonna send it to you because
I
I don't
appreciate it. I love it.
nah, not my thing. Nope.
But back to
So
heart
let's go
failure.
back to heart failure. Got all the way up.
That's okay.
Some of the signs and symptoms of heart failure, like we said, we talked about some of the signs and symptoms. Worsening of shortness of breath with activity. So, Brandy, if you know that last week you was going walking to your mailbox with no problem,
Mm-hmm.
and if you're struggling to go to your mailbox, that's a red flag.
That's a red flag.
Like that's a red flag. If
Yeah.
you know that you usually can go up the stairs in your home, and now you're really struggling to go up the stairs, that may be a red flag.
I agree.
Okay?
So, and then what else? What else? Oh, well, we talked about the sausage legs. So if you notice like increased swelling in your legs or your ankles.
Another thing is, know how I know, Brandon, sometimes they come in there with slippers on.
Yep.
They tell me that I can't fit my shoes. That's a sign. Like I can't put my shoes on. My shoes are too small.
Yeah.
Yes.
Or you pull their sock down and it has that ring around their ankle, so it's like juicy, skinny, juicy.
Yeah. So the swelling, so increased swelling in your ankles and your feet, or your legs. Sudden weight gain. If I gain 2 or 3 pounds in 24 hours, red flag.
Red flag.
If I gain 5 pounds in 5 days, that's a red flag.
Yeah. So
yeah.
So that's the point where you need to contact your primary care provider or your cardiologist, whoever it is that you see that manages your heart failure.
And a lot of these patients who are diagnosed with heart failure, a lot of the cardiologists and the insurance plans have heart failure programs where they already have the diagnosis. So what they do is they send the patients like a scale, and so to weigh themselves every day. And if the scale is like above like the 2 or 3 pounds, it like signals the insurance company. And so a nurse or somebody call them to see how they're doing. If they're short of breath, they may contact the cardiologist to see if they want to increase any medications or if they want them to come in. So a lot of the insurance companies they have this heart failure program to try to prevent the patient from being hospitalized for congestive heart failure. You can control it in the home and get under control. You can prevent the hospitalizations.
Yeah, which is critical right now with how crazy things are at the hospitals.
Yes, yes.
And then
so what are some of the
one of the other thing is like sometimes people with heart failure will sleep on like multiple pillows, because if they lay flat, then all that fluid just kind of sits there and it's like they're being smothered. So they basically, a lot of people, when I was doing home health, a lot of my patients with heart failure would sleep in a recliner.
Yes, that's what I'm about to say. I saw somebody today who he told me the recliner was his bed.
Yeah.
Like that was his bed, and that was because he's on heart failure, he's on oxygen. He can't lay flat. He can't lay flat. Like you said, they feel as though they're going to smother themselves. So yeah, that's another thing. If you see somebody who don't want to lay in the bed, just want to sleep in a recliner, and they haven't been evaluated, get them evaluated, y'all.
For sure. And then loss of appetite, because the fluid on your body just makes you feel full. So if you notice like I don't know, like you just kind of gradually are not feeling as hungry as you were the day before.
I'm scared to eat. I'm scared to eat because I'm using so much energy and oxygen trying to eat. I'm scared to eat because I think I'm going to smother myself. So I don't want to eat. So but that's why the loss of appetite. And another thing can be dizziness, confusion, lack of oxygen. And it has sadness and depression, which I guess that goes with just the disease process itself.
For sure, because these people's quality of life is less than what it was when they didn't have heart failure. So these, you know, they could have been like very active, running around with their grandkids, going places. Then you develop heart failure and you don't have the energy to go places. You don't have enough air to like just go to the mailbox even.
Yeah, you're right.
So that, I mean, that would make me depressed.
So we know we both are big on prevention. You are my prevention hero. So tell me, so how can we prevent? How can we prevent this disease? And how can we just, and even if we do get diagnosed, what can we do so it don't get worse, or how can we prevent it?
So prevention, stick to a healthy weight.
And how do we do that?
Exercise. Yeah. Jump jacks. Eat fruits, vegetables, whole grains, definitely like foods rich in fiber, just to keep your gut happy, pooping regularly, because that just makes you feel light, right? And then lean proteins.
What should we avoid?
Sugar, things like fried foods, all that really yummy stuff.
Yes.
Don't eat it. Eat it in moderation. So, you know, you don't want to deprive people of stuff and be like, you can't have this, you can't have that. People are going to fall off. They're going to get frustrated, and it's
do
just
it anyway.
Yeah. So just teach yourself to eat stuff in moderation. So maybe if you usually order a large fry, get a small one, or if you get soda, get diet. I don't know. Just make little changes until you're where you want to be.
Yeah. I'll try to avoid alcohol. If you're smoking, quit smoking.
Right. Oh, what's the big thing with diet though, with heart failure?
Lowering is your sodium intake.
Yeah.
Yeah, it's your sodium intake, your salt intake. That's one of the biggest things. I think it's no more than 2 grams of salt a day.
Right.
With heart failure, and it may be person by person, maybe situation. They may tell you to do less than that. It just depends on your case. But lowering your sodium intake is very important. Yeah, and people don't realize when you go out to restaurants or when you buy fast food, it's hard for you to control that sodium intake. With you have to cook the food, what if it's processed? So it's kind of hard. So you do better by preparing your own meals,
right?
So you can control that. Yep.
And go ahead. One way that I get a lot of sodium, I gotta admit, is I love me some canned soup, but it has so much salt in it. They got the low sodium, but now it tastes good. I want to add a little salt.
And so I tell my patients who use canned soup like that, Brandy, to rinse that stuff off. Like rinse those vegetables off several times. Yeah. Or let it soak in water. And I don't know if that really helps, but to me, it gets some of the sodium off it. Yeah. But yeah, you're right. Canned soup you better stop eating all that canned. You do be having canned soup for lunch. Like every time, yeah, you do. You take a whole can of soup for lunch and fix. I've been watching you. I'm gonna stay on her. I'm gonna stay on her with this sodium because almost every day for lunch she have a can of soup.
Not every day, but
at least once a week you bring a can of soup.
We went from every day to once a week. Let me have my soup. No, so but yeah, so like B said, don't smoke or use recreational drugs. Get enough sleep and reduce your stress. So whoever's stressing you out, tell them you got to go because I cannot be developing heart failure behind your drama.
Another thing, what you say, get enough sleep. I think people don't realize that getting the proper amount of rest, it relaxes your body. It doesn't put as much stress on your heart. So when you don't get enough sleep, your heart is stressed. Yeah. And that can cause problems. Yeah. So I think that's something, that I just wanted to say.
So you're a woman of many tasks and jobs. Do you get enough sleep?
Brandy, I do. Okay. I try to get at least 7 to 8 hours sleep at night. And I think I'm so it's asphyxiated in my mind that I start counting. Okay, if I go to bed I'm serious. I know it sounds crazy, but it's the truth. Yeah. You can ask my husband. If I go to bed at 9, okay, I could sleep until, I could get up at 5 or I could get up at 6. Like it's in my head. I know, it's late. I can't get up tomorrow till 9. Like, so it's, So I try, I get my sleep.
Well, good. You know how many hours of sleep I got last night?
How many?
Approximately 3.
See, no, I can't function like that, Brandy. I can't. Let me tell you something. When I was in college, my friends would tell you we'll try to do like all night. You know how nursing school is. You stay up all night. We would go to the library. They had a 24-hour library and stay there all night. At midnight, they would tell you Brandon was on the table like this. Guess what time Brandon woke up? 6 o'clock.
Oh my God.
So they was up studying all night. But if I did that, I didn't do well on my tests. So I had to. If I didn't know it by midnight or 1 o'clock, I wasn't gonna get it. So I had to go to sleep. That's the only way I could function.
I love to sleep, but I don't know. Sometimes I just can't.
Brandy, the 3 hours sleep, that's not good, friend.
I know my eyes feel heavy.
Well, I'm gonna have to get off there. We're gonna have to get off here so you can go to sleep.
Well, I'm not gonna get to go to sleep as soon as we get off here. But I do plan on getting me some good melatonin deep sleep tonight, okay?
Okay. So let's talk about treatment. We keep getting off. But listen, but it's still on topic. So let's talk about some of the treatments. Medications. Mm-hmm. Like we said, cholesterol medications to control the way the heart pumps the blood flow to the body. Let's see, surgeries. Sometimes you can have to get open heart surgery, stents. What else? Pacemakers may have to be placed.
Yeah. And then, of course, the same way you prevent it, you also use some of that stuff to treat it. So diet and exercise. And then I think that's about it. So we already told you limit. And Brandy said is patient by patient, but you definitely should not be taking in any more than 2 grams of sodium. So that's 2,000 milligrams of sodium.
Yeah. And sometimes the heart failure the treatment can be irreversible because the heart has been damaged so much that it's irreversible. Mm-hmm. And at that point it becomes really a serious condition. Yeah.
And that's at that
point to death. So
yeah. And I think that's probably when people start to get depressed behind it.
Yes. Okay. Well,
that pretty much sums up heart failure. We gave y'all a little dose of everything. But Brady's going to talk about our disclosure.
So as we tell you every week, this does not take the place of replacing your primary care provider. You're going to see your primary care provider.
Not at all.
This is just information to spark a conversation with family and friends. So when you do see your primary care provider, you have these symptoms, you can say, hey, check me for heart failure. Mm-hmm. So that's the whole purpose of this, you guys.
Or if you see your friend and their legs are looking a little puffy, you can be like, hey, friend, I love you, but your legs are looking kind of swollen. You've been checked for, like heart failure? Because B&B said that's a sign.
Wait, Rand, it's another one. So if your friend huffing and puffing, you're taking a walk and huffing and puffing, mm-hmm. Friend, let's go to the doctor. Let's go to the emergency room and get you checked.
Because B&B said that might be fine. But yeah. So today's episode is sponsored by the Candy Lady Cosmetics.
I'm wearing a shirt.
And their slogan is Glam on the Go. So tell us about it.
So it's a cosmetic company. I'm wearing a lipstick today. This is Erin. I really like this. And I did put a little gloss on it. One of their cotton candy lip glosses on it.
I think that I have on cotton candy too. No, I have on passion fruit. But let me show y'all how good it looks.
Now she on. Yeah, it's pretty on you. So yeah,
it's pretty on everybody.
Yeah, you're so silly.
Yeah,
so that's all we have for you guys today. Remember to subscribe, like, follow, and share B&B the Community MPs on Instagram, Facebook, and YouTube. And
stay tuned because we are going to go live with our podcast soon.
Yes, we are.
But yeah. What's up?
What you was about to say?
I don't know.
Well, we can tell them what we always tell them. Why do we do this?
Because community.
Wait. Stop. Hold on. We'll do this again.
Wait, okay.
Why do we do this?
Because
Community
is our beauty.
Yes.
Y'all have a great day.